Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about public health, infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and with me, as always, is Dr. Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmidt. Good morning, good afternoon, or good evening to those who are watching or listening to us today.
Today we have a special edition, and this is where we left you last time. And Melvin, maybe you can start from here.
Yes, we showed this cartoon last time, and basically what we're trying to say here is that, fake stuff and fake news is all over the place, right? We are all in social media, whether it be Facebook, LinkedIn, Twitter, or what is now called X, Instagram, or whatever. And we can see all these different information, some of them fake, some of them um, real, and some of them are actually bit in between, right? They're like pseudo fake news, but if you really look at everything, then it's misleading. So this is what we are discussing today in Global Healthcast.
And you have the next slide as well to give us some examples, I guess.
Yes. So if you remember, these are some of the different fake information that were spreading during the height of the coronavirus pandemic. So the first one there, you will see that they said that in Russia, the government unleashed over 500 lions on the street to just make sure that people don't go out during the pandemic outbreak. The one, the white one on the right of the screen, you will see this misleading information that when you use steam, you are basically inactivating the virus in your nostril or your lungs or throat. And those below is you can see it, right? The other one says that cocaine can kill the coronavirus, and the other one is saying that weed or marijuana can kill the coronavirus. So I think these are just some of the examples of those really famous fake information that spread during the COVID-19 pandemic. And so what we talk about today are these things. So first, we talk about how fake news gets so much attention. We also discuss why are we as human beings so susceptible to fake news. We give examples. So this one is the polio vaccine and infertility. Where did this come from? Professor Schmidt will give you more examples of fake news as well, and then we will discuss the evidence, the evidence-based approach in scientific medicine. We also talk about who you can trust, and last but not the least, how to avoid becoming a super spreader of misinformation. So, how does fake news get so much attention online? This is something that a lot of people have been asking, especially during the pandemic, right? And it's actually started even before the pandemic. But these are some of the ways for fake news to spread and get so much attention. Firstly, it is often made to look like a well known newspaper or a well known TV personality is saying it. It might be what is called a clickbait. So it's a misleading or shocking headline designed to get lots of clicks and draw people in. So when you say clickbait, the goal is really for you to be so curious, right? So you see something that's so ridiculous, you want to click it. It may be shared by people by mistake who did not read it fully, or it could come from one of your online contacts or your friends on social media, and you just maybe look at it because it was shared by someone you know. It could have little nuggets of truth within the whole article that makes it a little bit plausible. It is often written to make people worry so that it gets noticed, right? Because if you share something so happy or something that's successful, people just maybe click on it, right? But they won't really share or read it. But if it's so worrisome, and if the news is so terrible, people are actually more inclined to read it. It could also play on your prejudice and trigger racist reactions or extreme views. Fake news may also appear as a pop up or in social media feeds, web pages, or in mainstream media. It could be a satire, right? It's meant as a joke or a parody or a hoax. And because it's so weird and funny, people will click and share it. And last but not the least, it may be simply poor journalism, right? With facts that are not properly checked and not properly vetted. And I think we have seen this now where the the goal is really to send out the information as quickly as possible without really checking. So that's we see this now in even the mainstream media and mainstream newspapers that sometimes they make mistakes because they are in a hurry to release the information and they don't really fully check or vet the information. So yeah, so these are some of the ways fake news can get so much attention.
And the question then comes up, why are we so susceptible to fake news? Why do we like them? Why do we share them?
Yes. So humans in general are really very bad at detecting fake information. This is because fake news often looks like real news, and we think we recognize a pattern. And I think even for myself, I see it, right? When I see a news item that's really ridiculous, that is something that will make me click. I mean, I don't share it, but I would click and read because it's so ridiculous. Secondly, fake news has an advantage when it comes to sharing information because, again, when sharing information online, many people give things very little scrutiny, right? Many people don't really read what everything that's written there. They just see the headline or they just see the first paragraph. And we are also more inclined to share bad news. There was a study done in the past comparing the number of shares of an information that's good versus an information that's bad. And in general, people share bad news. And the other thing that we have noticed as well is that misinformation thrives where people have very little control over what's happening, right? So if there's a volcanic eruption, if there's an unpredictable weather pattern, a typhoon, or some new disease, people are very scared and they don't have a control of what's happening. And modern psychological research agrees that under uncertainty, people seek safety, security, and order to compensate for lack of control. And when they see an explanation for what's happening, they they tend to believe and share.
Yeah, they like simple explanations when the problem is probably very difficult, very complex, and incomprehensive. But you brought us one example that I think is very instructive. Can you explain it?
Yes, so this is an example of the roots of the polio vaccine suspicion, especially in Nigeria. So this, I mean, I've heard about this many years ago, even before the COVID pandemic. When I was still a student in vaccinology, I've already heard about this. And this is really sad that this is happening in a very big country like Nigeria. And for years, there has been suspicion that the polio vaccine is laced with infertility hormones as part of a US led plot to reduce the Muslim population in the world, specifically in Nigeria. So in the Kano state, in one of the regions of Nigeria, the government suspended the polio immunization between September 2003 and November 2004, following the spread of such rumors by some of the Muslim leaders. And the suspicion led to an unprecedented number of infections and transmission of the virus to almost 20 countries that had been polio free in the past. And really, this also came out from something that's fake news, right? Because they were saying that the polio vaccine has some ingredients that would make them infertile or unable to procreate or have children. And for these people, it's very important for them to be fertile and have kids, right? And so that was really one of the reasons why this the spread of polio in Nigeria worsened and even spread to other countries.
Yeah, I think this is one very good example where it really had a big implication on global public health, right? Not only on one country, but globally. Now the question comes up: what is scientific evidence with a focus on medicine? And given this polio example, there was a theoretical explanation why that could be. you would put hormones in there. Or with COVID, the idea was there is a cross reaction between hormones that are responsible for fertility and receptors that are similar to the coronavirus. And if you get the corona vaccine, then you will no longer be able to have any children. So let's, sorry, let's have a look a little bit at what is scientific evidence. Number one, there is the big field of hypothesis. You can hypothesize anything. You can hypothesize tomorrow the moon will fall down on the globe and we all will vanish. That is a theory, and it is probably not too difficult to say this is unlikely to happen, right? But sometimes some of these hypotheses make sense if you are not in the field. This receptor issue with the COVID vaccines is really something, if you hear it, it seems plausible, although it isn't. If you are an expert in hormones and in virology, you would say this is all stupid. But they may make sense. So you should be very suspicious if there is a hypothesis. Sometimes the hypothesis is theoretical, like the one with the receptor similarities and coronavirus and fertility hormones. There may be even animal data. You may have animal data, and then you may see a vaccine is doing whatever type of harm, but that doesn't predict it will happen to humans. So you have to be very careful if you do assumptions from animal study and say this is what will happen in humans. And there are other type of data that I don't go into, but basically, if there is a rumor or if there is any news, try to find out and think, is this a hypothesis or is there any data? Now, the real good scientific data, if you want to say cause and effect, does a vaccine work? Is a medication causing a side effect? Whatever. For that, you need experimental evidence, and the standard for that is a double-blind, randomized, controlled human study. Half of the population that you study receives the real vaccine, and half of them receives another vaccine that won't work against COVID or whatever your target new vaccine is about. And then you can compare the disease frequency in the real group who received the vaccine and in the group who received another vaccine or another placebo. And then you can find from the difference in the frequency of the incidences if the vaccine is working or not. That is an experimental study, and only such studies can tell you about side effects, about efficacy of vaccines or products, and everything else doesn't work. Again, hypothesis, but no real evidence. And finally, once you've had the experimental evidence and you know the vaccine is working, you can see and ask the question, what is the good that the vaccine is doing in the population? What is the effect all over Germany, all over Switzerland, all over the United States, wherever you are? So you use the vaccine with a vaccine uptake of 60, 70, 80, 90%, and you see a disease reduction, and you may see more positive effects of the vaccine, like herd protection and others. So again, experimental design is number one, and that is proof that something is working. And observational studies can only tell you if this happens, then the magnitude of the effect is as large as that was found in observational studies. Very often, people don't do the experiment, but they come with the observational study. And that is particularly true for nutritional studies. You may remember the studies telling you that red wine prolongs life. That is an observational study. From an observational study, you cannot make the conclusion. People who drink red wine have a different lifestyle. They live in France, not in Norway, or not in the United States, or not elsewhere. So there are many differences that can also explain why people live longer or shorter or whatever the effect may be. So be very cautious with observational studies. Don't trust them, or only trust them if first there is experimental evidence. So this is the basic principle. Now, how in this theoretical framework, what can you really do? I think what you can do is, if you want to have trusted information, you go to peer-reviewed journal. Peer-reviewed means you do your study, you send it to the journal, and people who are experts in the field, they say, yes, this is a good study, it is real good news, or it is a bad study. These are trusted journals, and this is where you really should look up good news. Science is a process, and what the peer reviewers do usually, they look at the methods. So for a real expert, the result is interesting, but as interesting is the methods. How do you come to your conclusion? What did you do to come up with that finding? So this is really a very important part. And again, finally, once you have published your data and you found that a vaccine is working or that a vaccine causes a certain side effect, then there may be a scientific debate about interpretation of the data. And that is nothing to do with fake news, but this is something very regular. If you find something, you can interpret the data, what it means for your daily life. If you should use the vaccine, not use the vaccine, whatever. This is roughly the evidence project, the evidence process, the procedures. This is how it works. Now, um, Melvin, before we go ahead with your next point, any additions to what I said so far?
This is very good, Professor. And I think the other thing that people should understand is that this peer review process, as you mentioned, is not 100% effective, right, in weeding out information that might be controversial. Even in before COVID, even in the past, there have been big journals like The Lancet or in New England Journal of Medicine who have published some studies that in the end were retracted, right? So the process is actually very iterative that even though something is published, it could be retracted if after a few months or even years, we see that there were some issues in the methodology that Professor Schmitt mentioned.
Yeah, yeah. Now, Melvin, coming back to practical items, the question is, how do you avoid becoming a misinformation super spreader? And maybe you can elucidate us here.
Yes, these are some of the ways on how to avoid becoming a misinformation super spreader. So, firstly, the most important, at least for me, is educate yourself. The best vaccination against what the WHO or the World Health Organization is calling infodemic is to understand the tricks that agents of disinformation are using to try to manipulate you. One strategy is also pre-bunking. It's a type of debunking that happens before you hear myths and lies. So, for example, right, before you hear something in social media or hear it on the news, if you listen to us here in Global Healthcast and we tell you that this is really not true, then the chances for you believing those false information is much lower. Secondly, it's important to recognize your vulnerabilities. Because we are all prone to believing such things, even me, even Professor Schmidt, when we read something, it doesn't mean that we are really 100% immune to believing these things, right? Especially if something is outside our sphere of expertise. The other thing to consider is consider the source. It's very important, right? Um, there's source of good information and source of bad information. In the news media, it's also the same. Media outlets have a range of biases, right? So it's important to check their biases. And there is a website called the Media's Bias Chart. You can check it. It describes which outlets are most and least partisan or biased in terms of reporting facts. The fourth tip is taking a pause. When you see something online, you can read it, but don't really think of sharing immediately, right? Pause, read it, pause and think about it, and you don't really have to share. Because I think most people think that when they see something interesting, they should share or they want to share, but that's actually really not true, right? You don't have to. Take a pause. And last but not the least, be aware of your emotions. People often share things because of their gut reactions, because of the conclusions, right? They don't critically think. They see something and their emotions are stirred up and they want to share something. There's a recent study showing that people who viewed their social media feed while in an emotional mindset were significantly more likely to share misinformation than those who went in with a more rational state of mind. And anger and anxiety in particular, they make people more vulnerable to falling for misinformation. So I think these are some of the steps that you can think about. And this on the right side, you will see a game. It's actually developed by researchers at the University of Cambridge. It's called Bad News. So you can check it at www.getbadnews.com. And it's really helping people identify the different ways information can be shared with you and different ways misinformation can prey on your biases, right? So it could be an impersonation, it could cause polarization, it could just be trolling, or many of these things here, or just because your emotion is heightened. And so it's a really good game. I've tried it, and it's really interesting. It will teach you many things about yourself and how you react to news.
Thanks for sharing this. Sounds like I have to do that right after our clip today. Melvin, let's summarize what we covered today is how fake news gets so much attention and why we are so susceptible to fake news. We had some examples like polio vaccine infertility or COVID vaccine and infertility. I explained what is evidence in clinical medicine today with a little bit of a focus on vaccines and hypothesis, double-blind randomized studies, as well as phase 4 studies or observational studies. And then Melvin explained whom you can trust and how to avoid become a misinformation superspreader. Thank you, Melvin, for giving us all this great information today to make us more careful with what we're sharing. I thank everybody for listening to us today, and I say goodbye until next week. And Melvin, you have the last word.
So thank you very much for watching, everyone. If you just remember 2 points from this whole Global Healthcast today, educate yourself and take a pause before you see something online. Thank you very much. Stay safe.